Angie Carpenter here with our Supervisor Spotlight, and I'm delighted to have with us as our guest today Dr. Chris, who is head of emergency medicine for Catholic Health, Good Samaritan Hospital, and here we are again.
We are.
We are. You know, we have had a couple of shows, especially during the head of COVID. And Dr. Raio has been so generous with his time, and I'm really so appreciative of the fact that you're here again today. And from all we hear from the media, there seems to be a little spike again, so we thought it might be a good idea to have you come back and run us through the whole drill and what we can expect, or if we can foresee what to expect.
Great,
so
thank you for having me.
What are you seeing at the hospitals?
So we're seeing a little bit of a bump up, which was expected really with the change in season.
Mm-hmm.
We were expecting to see some more cases, but I would say that everything is very calm, very much under control, and we're happy with the way things are going. No major issues certainly from the healthcare perspective.
Well, that's really good to hear, obviously. It's interesting, and I'll share something. I was feeling a little under the weather, and normally, in years past, it would have been, have a cold and so forth. And of course, everyone in the office is going, oh my God, you coughed. You should go test for COVID. So normally I wouldn't have bothered, but I went to an urgent care and tested for COVID and, was negative and grateful for it. And it was just a viral thing and got an antibiotic, et cetera, but, and feel fine and did throughout the whole thing, although I sounded worse than I felt. But it was interesting to me when I said something about testing for COVID. It wasn't almost like a given where it might have appeared to be so a year or two ago. So what is the dynamic of what's happening there with that? Are people not testing as much, or like what's going on with that?
I mean, I think, from in the homes, and I think a lot of it's personal choice. I mean, I think if you talk to your friends, I talk to my friends, some test all the time, some say, why would I ever test for COVID? So I think there's probably less testing, on a personal level and, with self-testing at home. I think in the healthcare setting, we're testing for not just COVID, but now that we have available to us these tests that will test for, 20, 25 different viruses. So you are going to hear about other types of viruses and, cases, the case numbers for those are going to go up because now we're testing. Mm-hmm. In the past, patients would come in with, viral symptoms, stuffy nose, congestion, dry cough, and we would say, oh, you have a virus, a common cold, and we would send them home. Now we have testing available to us, and we are using those tests more, particularly during this time, testing for flu and COVID. Those are the ones, typically we really want to know about. We have some treatment options available. So we are using those tests more.
So, from a layman's point of view, it appears that, post-COVID, there's been this need or this feeling that we need to know, what it is. Mm-hmm. So it seems from what I just heard from you that would bear true.
I think we're worried about the people who are immunocompromised, elderly, or very, very young. People who have a greater potential to get very, very sick. In terms of does everyone need to know what virus they have? We probably could debate that for this entire episode and more.
Yeah, exactly.
I think we're always more concerned about elderly, immunocompromised, or very, very young people. If you're about to go to a wedding and you're coming down with a cold, should you test? That might be a little bit different discussion than if you just have the sniffles.
Back to my particular instance and going to the urgent care, they said, well, while we're testing for COVID, we'll test for, 20 some odd, viral things. So of course you got the second, swab up the nostril that
Right.
you felt like it touched your brain. It went up that far.
Right.
But, it's like, okay, so big deal. It's something viral. I don't know what it was. But, and also, too, we're hearing about RSV. Tell us about that.
RSV is a virus that we've been treating, ever since I've been practicing. I think, again, we're starting to see more patients know about it because we're doing these tests that will come back for RSV. So in adults, RSV typically will present more like just a common cold symptoms. For, again, immunocompromised, elderly, very, very young patients can get sick with RSV. But, this season is really no worse than some of the years we've had in the past. It's not a new, novel thing that we're seeing.
So perhaps the awareness of RSV is been increased because all of a sudden now there are commercials on TV and we're hearing about a particular drug that you can take for RSV. And I remember when I heard it the first time, well, what the heck's RSV?
Right. Yeah, it's something that we have always been aware of, and we do see young kids particularly get sick with it, but it's not something new to us, certainly in the healthcare setting.
Okay, so just another thing that's out there that we probably don't really need to worry about unless you've got that.
Yeah, unless you're
criteria that
again,
you talk
elderly, immunocompromised, very young. Those are the populations that we worry about. And, there is now a vaccine available to patients over the age of 60. So that's probably why, it's more mainstream and people are talking about it.
Oh, okay. Good to know. So we will take a little break here and come back with Dr. Chris Rayo from Catholic Health's Good Samaritan Hospital. Thank you.
You're watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. This is Angie Carpenter from the town of Islip, and we're here today with Dr. Chris Rayo, who is the head of the emergency departments, of course, Catholic Health, particularly Good Samaritan Hospital, and we were discussing COVID, that it's here and probably will be here forever and ever in perpetuity, just something else that's been identified that will probably always be there, and just the way we get a flu vaccine, and now we spoke earlier about an RSV vaccine being available. What is the protocol as far as a COVID vaccine? Should people be looking at getting boosters every year?
So, there is a new vaccine available. It is recommended for anyone for the new variants, particularly, again, if you're older, immunocompromised, et cetera. You can get the new vaccine anytime up to 2 months after you've had any prior vaccine. I think, what we're seeing is people are kind of hesitant, but it is recommended that they receive that second vaccine for the new
So when you're
variants coming
saying
up.
older, are we talking someone who's 60, 70? What are we talking about?
Yeah, I think anyone over the age of 60, I would say definitely
Okay.
should get it. It is recommended for everyone, but as I'm sure
Are
you're
there
seeing.
any demonstrated side effects from it, or is there something?
The vaccines
Just
are
kinda
safe.
like getting a flu
Yeah,
vaccine.
I don't think that people should be worried about getting the vaccine whatsoever. And again, it is recommended that they get it given the new strains that are coming out.
And I think I'm right in saying this, but the pharmacies are giving the vaccines.
Absolutely. Yeah,
So-
early on there was a difficulty with access to vaccines. I don't think that's the case anymore.
Okay.
They're readily available.
Okay, so, belt and suspenders, if you can protect yourself, why not?
Yeah, absolutely.
We've been getting the flu vaccine every year, and probably this is something else we'll do going forward too. Apart from COVID and everything that's happening there and this time of the year and some of the initiatives that we can take, and we can talk about that, but I'd like to pivot for a minute and talk about some of the things going on in the system in Catholic Health. I know we see construction going on around there right here in the town of Islip. We see what's happening in the pavilion at Good Samaritan Hospital. So can you talk a little bit
Sure.
about the progress there and what people can expect?
So I think it's a very exciting time for the physicians and the healthcare teams at Catholic Health. Our new leadership, Dr. Patrick O'Shaughnessy, who you know very well, has been very active and aggressive at building programs, and also what goes along with that is a lot of the construction that you're talking about that's not only happening at Good Sam, but really across the system. But at Good Sam, obviously, we're very excited. You see the new building is up and set to open in 2025. And that's our new patient care pavilion, which is really a brand new emergency department on the bottom level, brand new state-of-the-art operating suites, and then patient care floors above that. We think that the new pavilion really is just going to match the environment to already the outstanding clinical care that we provide. Over the last 8 to 10 years, there's been tremendous programmatic growth at Good Sam with a level 1 trauma program, pediatric trauma program, cardiac program, neurointerventional stroke program. We're the only comprehensive stroke center on the South Shore of Long Island. And, we feel that this new pavilion is just going to match the environment to the care that we're providing to our community.
I would imagine that everyone wants, the best kind of possible work environment. And it's no different for physicians and nurses and all of the other, clinical staff and support staff that goes along with something like that. So by investing in providing that kind of environment for those that work in the system has to go a long way towards recruiting the best and the brightest.
Absolutely. And I think, right now when we're talking about recruiting people and hiring people, we speak to the care that we provide and the teamwork, et cetera. But now we're going to have the look that's going to match that. I think it's important not only for the patients, but like you said, it's going to give even more pride to the people who work in that environment.
And if the people that are working there have that sense of place and being happy to be there, it can only translate to the patient.
Sure. Yeah. And we also realize now, we have the system behind us. They're investing in us.
Oh, absolutely.
And I think that it just lifts everybody up a little bit. And, seeing that building up there gives all of us a lot to look forward to. And it's just an exciting time for the whole system.
Also, from what I remember in some of the meetings and hearings that were held during the initial stages when it was all being proposed, no beds are being added.
Correct.
But it's going to be private patient rooms, which is what they're looking to do industry-wide.
Right.
You know, to provide that experience of a private
Yeah.
room and so forth. And also, too, the logistics of the emergency room in relation to where the operating suites are a lot more convenient and contingent than what they were in
Correct.
or existing now.
Yeah, so we're not actually, you know, everybody says, wow, you guys are really growing. We're not really growing from a patient volume perspective, although it may go up a little bit. Like you said, we're just making the environment for each individual patient better. There have been studies that show if you're in a much calmer, quieter, soothing environment, you actually heal better. And, you know, with individual patient care rooms, you know, that's really the standard today.
Well, let's talk about that. How many times have you've known someone who's been in the hospital and they go, oh my God, this guy that's in the next bed, I can't believe it. They snore, they're,
Right.
you know, screaming. They have 20 visitors and I can't sleep, and you
Yeah.
know, it just
Yeah, it's just
stands to
it's going to
reason.
provide a better environment for the patients and for us as well. In terms of the layout, like you said, the operating rooms, there's going to be a straight shot elevator up from the emergency department to the operating suite. We have 3 state-of-the-art CAT scanners that are going to be centrally located right in the emergency department. One of those is going to be dedicated only for stroke, which, as you know, is a very time-sensitive diagnosis.
Absolutely. That
You know, so
that magic window of 3 hours is crucial.
I mean, we're going to be, you know, even better equipped to handle anything that walks through the door.
Well, I know that they've recruited some top-notch physicians in the area of stroke. And there was just a naming opportunity for the Richard family that believe so much in what is being done there that are having the stroke center named after him. Am I correct? Did I read that correctly?
Yes.
So
Yeah, I mean, and to see that just gives all the team, you know, to see that the community supports us, you know, it just makes us, you know, go to work with a little bit more pep in our step every day.
Yeah.
We see the new building, we see the community starting to back us. You know, we're there to treat the patients in the community, and to see that support is just great.
Yeah, it's great. It really, really is. And I know system-wide, other facilities across the system likewise are seeing that kind of confidence and investment from the system. And of course, St. Francis, St. Joseph's, Mercy,
St.
all
Catherine.
of them
So
are,
really system-wide, we're seeing investment in the facilities, which I think, you know, is a great step for us. You know, and it's just going to match the environment for the patients to the clinical care that we provide today.
You know, we spoke a little bit about the various disciplines, stroke being one of them, and just kind of glossed over heart. But certainly within the system, St. Francis is obviously a recognized leader nationwide in the treatment of heart disease, et cetera. But also, too, Good Samaritan has the St. Francis Heart Center at Good Samaritan. Is that not correct?
Yes, it's basically the, you know, same program, same physicians, same policies, procedures, same clinical care that you would receive at St. Francis. You can receive right down the road.
Well,
at
that's
Good Sam.
really encouraging. And we're going to talk a little bit more about that when we come back after the break. Supervisor Spotlight, thank you.
You are watching ITV, Channel 18, Islip Television.
Hi, this is Angie Carpenter. Welcome back to Supervisor Spotlight. And as I said before, we're here with Dr. Chris Raio, who's head of emergency medicine, system-wide for Catholic Health and based at Good Samaritan. And we were talking a little bit before the break about the heart program St. Francis, which not only is in their facility in Nassau County, but also in Suffolk County at Good Samaritan. And so much is happening there in the various, and I know it's not your discipline, but talk a little bit about the various opportunities there are for people with treatment for the various heart
Sure.
issues
So
that
as
may
I
arise.
mentioned, the services and the clinical care you would receive at Good Sam are the same as you would get at St. Francis. There are 4 distinct programs at Good Sam: open heart, cardiac imaging, a women's heart program, and also a minimally invasive procedural heart program where it's under the St. Francis umbrella. But really, all the cardiac services at Good Sam, pretty much mirror what you would have at St. Francis.
It's reassuring as a woman to hear that there is a focus too on women's heart health there, because people tend to think it's breast cancer that is the killer of women, but heart disease is the #1 killer of women. And I don't know that women are as sensitive and as good about getting tested and screened, having that baseline, cardiac testing done, as they may be with getting a baseline mammogram. That bothers me that we don't seem to have more of a focus. And, with the new year approaching and February being Heart Health Month, perhaps that is something we'll see more of a focus on.
Yeah, I think prevention is always the key, and it tends to be a more difficult diagnosis in females in general. But I think part of it is what you said. Perhaps women are not as aggressive about getting that preventative testing and knowing where they're at prior.
Well, I think women are concerned about taking care of everybody else and sometimes take care of themselves last.
Right.
And maybe the best thing you can do for your family and taking care of everyone is to make sure that you are taking care of yourself and that you are, healthy and you're being screened not only for breast cancer, but for, gynecological issues and heart disease.
Absolutely.
And also, too, we mentioned earlier about stroke and, that magic time with the 3-hour window for getting that shot to prevent long-term serious effects of stroke, but being aware of the symptoms. And, it's so easy, and I forget what is the acronym FAST?
Yes.
Yeah. So
I think,
tell us about
yes,
that.
I think stroke, first of all, it's an area of medicine where over the last, 8 to 10 years, there's been a lot of advances. So, in the past, we had the TPA clot-busting medication, and that was really the only option. And now we have interventional procedures where, highly trained, obviously, physicians can actually go in and suck out a clot, and I think we're seeing very good results with that. The team at Good Sam obviously is one of the best in the country. We're very, very proud of that program, and in the ED we're proud of it because we're obviously a big part of it.
Oh yeah, you're on the front line. You're getting it right away
as the patients come in. So I think that's one of the programs that we talked about. That's really bringing state-of-the-art care to our community locally.
Well, we certainly are very grateful for that and very well served by that. The winter months, we're here in the middle of the winter. People tend to get colds more. So what are some of the protocols that we can, or the preventative kind of techniques that we can encourage everybody, especially about the holidays when everybody is gathering?
Yeah, so it is true. People do get more viral infections and tend to get a little bit sicker in the winter months. The theory initially was just that you're inside more, so there's more patient contact. There are actually some medical reasons why patients tend to get viral infections more frequently. The immune system in the nose is actually, the immune response is actually blunted with temperature changes,
Oh, really?
particularly as it gets a little bit colder. I think it's really the basic stuff. Hand hygiene is obviously, one of the biggest things. If you're sick, try not to expose to others. I think, many people do that very well and others not so well. Don't share items in the household if you are sick, towels, utensils, glasses, stuff like that. And obviously, if you can improve ventilation at all, those would be the big things.
I guess one of the upsides of the pandemic was this hygiene awareness that everyone seemed to have raised the bar when it came to that with the washing hands. And I know how raw my hands would get because it seemed like you were always washing them. But it's a good thing. It's a really good thing. I know, and I can remember at work when we were trying, we're producing signs and putting everything up around the building to remind people to maintain social distancing, especially if you're started coughing or something. So those are things that aren't so bad to keep doing those strategies. And I have to chuckle, there's still a sign in the ladies' room, and it says, clean hands are happy hands. Right. And I chuckle every time because when someone found that online and printed it out to put up, we're all laughing. But, it's not funny, It's just a simple
Seems
thing to do.
Seems very basic, but it is extremely, extremely important. Yep. Not just for COVID,
and really, singing happy birthday 3 times or whatever they were telling us to do at the time, go back to that. Go back to that. It helps you. It helps everyone around you. And with the holidays, everyone wants to be together, and the last thing you want to hear is, oh, we can't come because somebody's sick.
Absolutely.
So I hope, what do you have any exciting plans for the holiday that you want to share?
So my son broke his arm, so
no.
we're probably just going to lay low and hopefully spend some time with the family.
Oh, okay. Well, spending time with family is always precious, and
absolutely.
Sometimes we take that for granted. So whether it's family, blood relatives or adopted family and friends, and some of us are very blessed to have friends that we consider family. So any time spent with them is really precious and special. And time spent with you is very precious and special, and very grateful
for
the fact
Thank you.
that you made yourself available. We really do appreciate that. Dr. Chris Raio from Catholic Health and Good Samaritan Hospital. So signing off to everybody. Have a great, healthy, happy winter season.